Concept and risk factor. Spine bifid is a condition that affects the spine is usually apparent at birth. It is a type of neutral tube defect. Spine bifid can appear anywhere along the spine is a neutral tube, does not close completely the vertebral column that projects the spinal cord does. Not form and close and short, this usually leads to spinal cord and nerve damage. Concept and risk factor. Spine bifid is a condition that affects the spine is usually apparent at birth. It is a type of neutral tube defect. Spine bifid can appear anywhere along the spine is a neutral tube, does not close completely the vertebral column that projects the spinal cord does. Not form and close and short, this usually leads to spinal cord and nerve damage.
In this fetus with spina bifida, you can see an opening in the back with an exposed spinal cord. Prenatal repair is usually done between 20 and 26 weeks gestation. Once the mother is under anesthesia, we make an incision in the abdomen to expose the womb. The womb is then opened to expose the back of the fetus using a specially designed staple to control bleeding. The tissue over the defect is then opened and removed. Next, the spinal cord is free from surrounding tissue before it is protected using the dura. We then close the muscle layers over the defect to further protect the spinal cord. The skin of the fetus is then closed over the defect. If a fetus does not have enough tissue on its back for primary closure, we will repair the spinal defect using patches as shown here. First, we protect the spinal cord by suturing a patch over it before we lay down a second patch to reinforce the repair. We then close the large skin defect using a piece of skin substitute to complete the repair. We then close the womb and conclude the surgery by closing the mother's incision. Ideally, the pregnancy is continued until 37 weeks gestation before the baby is delivered by C-section.
Diagnosis. Spine bifid can be diagnosed during pregnancy or after the baby is born. Spine bifid occulta may not be diagnosed until late childhood or adulthood, or it may never be diagnosed at all.
We went in for the routine ultrasound at 27 weeks, and as the nurse was looking at the ultrasound, she said, "Oh, wait a minute, I see something."
And I asked her, "Is it something that you can tell us?" And she said, "There is something wrong." And at that point, everything just stopped. And then you sort of get into the normalcy that is your life. And you love that baby, and you treat her just like another member of the family. With Sophie, she has a little bit extra care that we need to take. But other than that, she really is just like any other kid.
The only difference is she's exceptionally cute. That's a problem.
Eric comes home and says, "I can jump." And we all kind of go, "Yeah, no, you can't." And and then he shows you that he can. And you realize that the limitations that we set are those that we know. But because he has not known any different, he hasn't set any limitations.
I like doing karate and exercising so I can get strong.
Eric knows he has spina bifida. He knows, why he wears braces. He knows he's had surgeries. And explaining to your children what's going on and why is important too, because there's always going to be questions.
I don't let anything stop me from kicking or punching.
I don't think it's so much having a child with spina bifida has changed my life. I think it's being a parent has changed my life.
Hi, I'm Joshua Jones, and I'm an 11-year-old, and I have spina bifida. I think I'm just a normal kid, but there's obviously some differences. I go to the hospital a lot more than everybody else, and I have to wear leg braces and stuff like that.
We've encouraged Joshua's independence since he came home from the hospital. We started him with physical therapy at 6 weeks. His physical therapist adapted all of his toys. We taught him things like swimming when he was 3 and riding a bike when he was 3. Joshua has a huge part in his own medical care. We put together a medical notebook. For each specialist, there's a category, and Joshua has a page, and before every appointment, he's required to write his own questions to his physician. In the school setting, he has been self-catheterizing since he was 3 years old. When we sent him to preschool at 4, he went with a 3-alarm watch and a bag of catheter supplies, and we gave him the confidence that he could do it.
I like being part of my medical team because they listen to me better than my parents.
From the very beginning, we always thought that this spina bifida was just something on the side. We never allowed the spina bifida to come first.
My name is Ramu Mundakiri Kaldi, and I'm a health policy analyst at the CDC. I graduated from Georgia State University with a bachelor's in public policy. My parents, especially my dad, pushing me to do things that, but just to lead a normal life. Like, if I felt like I couldn't do something, it would push me. Everyone has to learn to be independent and living on their own, managing their own lives. Like, I am beginning to do that as well now. I go to my own doctor's appointments and manage my own all my doctor's visits and my medical issues. I play actually on a league because it's a wheelchair league. It's a small league, and it's all about the community. If I could give a young person like one major big advice is have dreams in life and stick to those dreams. Everyone has adversities in life, and your adversities, although different from others, aren't going to keep you from accomplishing your dreams.
During pregnancy screening tests are used to things and baby have spin or the other big defects. Tell to your doctor you have an equation on concern about the prenatal test. Stand for alpha fetoprotein, a protein produced by developing baby disassembled blood. Test that measure how much P pass from the baby to the mother blood at highest level. Could indicate that the baby has spina bifida. AFP test may even part of the test called triple screen, which checks for neutral tube defects and the other problems. Ultrasound. An ultrasound is typed on picture that is taken of the baby. In some cases, the doctor can see if the baby has spina bifida or think of the reason, where there may be gains AFP level. Spina bifida can often be seen with the test amniocentesis. In the test, doctor takes a small sample of the amnion fluid that surrounds baby in the womb. A higher than average level of AFP if the fluid could indicate that the baby has spina after the baby is born. In some cases, spina bifida may not diagnose until after the baby is born, Sometimes there are patches on dairy skin dipole on the baby's back that is noticed after birth. The doctor makes you imagine tests such as erase or skin scan to see baby's spine and backbone clearly. Etiology. The causes of spina bifida appear to multifactorial. Folate and deficiency is significant factor, and there appear to be genetic component. Other risk factors include material use of certain drugs and maternal diabetes. Signs and symptoms. Neurological. When the spinal cord and lumbosacral nerve roots involved, unusual varying degrees of paralysis and sensor defect and sit below the injury. Their usual discussed rectal tone. Hydrophil loss may cause minimal sinus symptoms or increased intracranial pressure. Brainstem involved can cause manifestations such as stridor, slowing difficulties, and intermittent apnea. Orthopedic. The lack of muscle innervation cause atrophy of the lower limbs, become paralysis, affects the fetus. Orthopedic problems may be present as severe arthrogryposis, hip dislocation. Occasionally, kyphosis is in which and making surgical close difficult and prevent the child from assuming the supine position. Scoliosing may appear later and is more common in children with higher lesions. Urological. The paralysis also impairs bladder function, sometimes causes neurogenic bladder and consequently urinary reflux, leading on gyphrosis, frequent urinary tract infection of unlimited with damage.
The term spina bifida comes from the Latin split spine, which is actually a pretty good description because spina bifida is a birth defect where the tissue on the left and the right side of the back that normally come over the spinal cord to protect it don't completely meet up to form a nice seal, leaving behind various degrees of an opening right down the middle of the lower back. Very early on in fetal development, the ectoderm, which is the outer layer of the fertilized egg, starts to develop a bit of a ridge that eventually becomes the neural tube. This neural tube goes on to become the spinal cord, the brain, as well as tissues that enclose and protect them, called the meninges. And spina bifida occurs when a portion of this neural tube fails to close properly, typically in the lower back. This constitutes a defect or absence of the vertebral arches due to a failure of mesoderm to organize over the region of the defect, and it may or may not involve the underlying meninges and neural tissue. Alright, so there are three main types of spina bifida, and the first is myelomeningocele, also called meningomyelocele. And this is the most severe of the three and happens when the spinal cord and the surrounding meninges protrude out of an opening in the bony vertebrae and are held together by a sac of skin that pouches out from the back. In really severe cases, there's no skin at all, and the nerves of the spinal cord are therefore exposed, a condition called open spina bifida. And this can cause serious damage to the exposed nerves, as well as risk an infection, resulting in symptoms like loss of sensation or paralysis in the areas of the body below the damaged site, bladder or bowel movement problems, seizures, as well as leg and foot deformities. Now, a myelomeningocele is typically associated with a condition called an Arnold-Chiari II malformation, which is where cerebellar and brainstem tissues slip down into the foramen magnum, the opening at the base of the skull. This Arnold-Chiari II malformation results in a variety of symptoms related to the cerebellum, and often results in hydrocephalus, an abnormal accumulation of cerebrospinal fluid in the brain. Alright, the second type of spina bifida is meningocele, sometimes called a meningeal cyst. In this condition, the prenatal spinal deformities result only in the meninges and not the spinal nerves, slipping into the gaps between the deformed vertebrae. This one's the least common form of spina bifida, and because the spinal cord itself isn't damaged, these individuals often don't experience the severe symptoms that are seen in myelomeningocele. All right, the third and final type is spina bifida occulta, and this is the most common and most mild form of spina bifida. In fact, occulta is Latin for hidden, which is appropriate since many of the normal prenatal tests used to diagnose spina bifida don't catch the disorder because the deformities in the tissues of the lower back are tiny. In spina bifida occulta, the spinal cord and surrounding tissue don't protrude, nor is any of the tissue forced into spaces between the vertebrae. Since the spinal nerves are undamaged, people with this form of the disorder are often asymptomatic, and the condition is usually only found accidentally later in life. At most, people might have hair, a dimple, or birthmark on their back above the site of the lesion. Now, the exact cause of all three types of spina bifida isn't known, but there are known risk factors like folate or vitamin B9 deficiency during fetal development. And therefore, prenatal vitamins include folic acid, which is the manufactured form of folate. The developmental deformities, though, that cause spina bifida often take place in the 4th week of pregnancy, which is 21 to 28 days. And this could be before a woman might know that she's even pregnant, and therefore she's not taking the prenatal vitamins yet. To help combat this, enriched grain products like breakfast cereals made with whole grains have folic acid added to the flour as a general preventative measure. Other risk factors for having a child with spina bifida include obesity, poorly controlled diabetes, and taking medications that interfere with folate metabolism, like certain anti-seizure medications. Diagnosis for the most severe form of spina bifida, myelomeningocele, is often done prenatally by looking for an increased level of alpha-fetoprotein, or AFP, in the mother's serum, which can happen when the skin surrounding the fetus's spine is missing and AFP leaks into the amniotic fluid and into the mother's bloodstream. AFP, though, can be elevated in other conditions as well. So in order to get a more exact diagnosis, additional blood tests for human chorionic gonadotropin, or HCG, inhibin A, and estriol, as well as an ultrasound are usually done. In more serious cases, amniocentesis, where a sample is taken directly from the amniotic sac surrounding the fetus, can be performed. For treatment, prenatal surgery is done to close a myelomeningocele, but this surgery can be dangerous to the developing fetus as well as the mother. In cases where postnatal surgery is chosen, it's often done within the first few days of an infant's life in order to minimize the risk of infection like meningitis. Even if the surgery is successful, people with this condition typically need additional interventions like urinary catheterization to help with urination and crutches or wheelchairs in case of paralysis or low muscle tone, because the damaged or underdeveloped spinal nerves can't be repaired. Alright, as a quick recap, the three types of spina bifida are spina bifida occulta, which is the most common and least severe, meningocele, which is the least common and also typically not very severe, and myelomeningocele, which is the most severe form of spina bifida. Thanks for watching. You can help support us by donating on Patreon or subscribing to our channel or telling your friends about us on social media.
Prevention. Folic acid supplementation 400 mcg orally once a day. Is women from the months before conception and throughout the first trimester reduce the risk of neural tube defects. See prevention of neural tube defects. Women who are considered is the best at high risk for neural tube defects, that is, women would have as fetus or baby with neural tube defect, should take folic acid 4 milligrams by month once a day. Objective on physiotherapy. Physiotherapy treatment is the malformation. The objective of psychotherapy treatment will be develop a physical capacity that make independence possible, independence mobility walking or the wheelchair. Finally, prevention of secondary deformities. Physiotherapy treatment. Aerobic exercise. Where will work on objectives such as improving cardiorespiratory capacity, reducing the feeling of fatigue, increasing walking speed, increasing functionality, or consequently in improvement of the quality of sleep adaptation and inclusion their environments, such as in school. Muscular strength training. People diagnosed with spina bifida is denied by discus with safe physical tension and muscle fatigue. That is why one of the part proposed on training for field of physical therapy, muscle strength training within the discipline of therapy exercise. Of the will help of the use of new technology or method of completion, such as hybrid platforms. In addition, muscle training is the Berlin layer link can also be preventive treatment to maintain muscle strength and functionality of the gait on method of movement uses crash can wheelchair. Sensitivity work. In this type of pathology, the shield presents an alteration of sensitivity corresponding to location of the lesion. Sensitivity work with the basis of helping distinguish different textures, temperatures, among other aspects.